Hi everyone, and welcome back to another week in Bundle of Rays. So you're listening to our podcast show, Reality. So this is where we talk to real people in real situations, doing real things. And this week we're speaking with Leanne Boase. Now, some of you might know her as probably one of the most senior nurses in Australia, working with the Australian Nursing Practitioners Association, and generally being a goodwill, good-hearted nurse and having a strong voice across the social media platforms and fighting for what's right for nursing. How does all that sound, Leanne?
It sounds like I do a lot more than I actually do, but I do try.
Give yourself some credit. I'm just going to give introductions really quickly. So for anyone who hasn't listened to this show previously, my name is Brad. I'm the director and founder of Bundle of Rays, which is a virtual reality-based education company. But from May, we're going to go into online learning. And part of that is delving into this media of conversation, which, you know, it seems so simple, but from what the last 4 weeks, we just find it so valuable just to have a conversation and share that. So that's one of the exciting things with our podcasts. Leanne, I'll hand it over to you.
Over to me.
Just for a quick introduction.
Oh, sorry. Yes, I am the president of the Australian College of Nurse Practitioners, but I'm also a nurse practitioner that's currently working in primary care and running my own clinic. And I have a background in running GP practices, owning GP practices, and working across the public and private health sectors in rural and metropolitan areas. So I feel like I've got a pretty good view of how most sectors work, including aged care. So I probably do get a bit over involved in some of the issues, and particularly during a pandemic, I think my main aim is to have some input and have some meaningful input and support our response as best I can. And one of the key issues that I've been looking at is how can we maximise the workforce that we have?
Yeah, as this unravels, it's just so fascinating to watch it come before us. There's so many logistical features to the healthcare system that, you know, we think on the go. There's a lot of people who are adapting and innovating. So let's, it's been a long week. I don't know about you. I've got a cold beer sitting next to me. I'm pretty sure you might have a wine, but just run us through your week and let's just talk and think about some of the broader issues about Australia and where nurses are probably at as they sit down for a glass of wine at the end of this week.
Gosh, what a big week. I think we've all been following the numbers really, really closely. We've been following the deaths in particular in Australia, which, now we've lost 8 people. It's very concerning. Overall, I think we are doing a good job, but there's still an element of people that are not taking it seriously enough. And when we look at what's happening overseas, it's utterly terrifying. So I think this prompts us all into action. This is what keeps us working really, really hard to do whatever we can to contribute. But overall, I think my week has been incredibly frustrating. I myself have seen a downturn in my own business, not seeing as many patients as I used to, and spending most of my time instead fighting to reduce the barriers to care, particularly for nurse practitioners, but also for nurses in general. There's a lot of barriers to us providing the care that we're quite well educated and prepared to give. And so frustrating is probably the biggest word for this week.
Yeah.
And feeling like, so many of us could be doing so much more if only we were enabled.
Yeah. It's just so many moving parts and everybody is trying to do their best job. And, I've been speaking to a lot of people. I lived in London for 8 years, so a lot of my best mates are over there. And, some of the units, I'm an intensive care nurse by background. And, some of the units over there are 20-bed units with currently having 60 patients in there. Like what I'm hearing across the UK is friends of mine live out near Worcester and they go for a drive and they get stopped by the army. This isn't this isn't a joke. This isn't nothing. This is not the normal flu. What we're living through is a real generational event, if not a century event. And how our healthcare system copes with that is just it's so interesting. But this week I've had a little bit of positive, these charts that we're seeing, and Australia seems to be curving. Our deaths are increasing, but in relation to the US and the UK and other countries, we do have a bit of a curve. And internally, I'm like, oh, come on, please. But yeah, there's a lot of complexities, and I've seen. I work clinically as well. Communication from one nurse to another, to managers, to directors, to the health service, to sister hospitals. It's all challenging, and to understand what the end game is and how to get the message out. But, everyone really is trying to do their best job. There's just so much to do.
There is a lot to do. And look, I agree. The numbers are looking better. And I completely agree that Australia is doing a better job than many other countries. But, when we are doing such a good job and we are starting to feel a bit better about it, there are fears of complacency starting to creep in, and everybody needs to be aware that this is a long haul situation, and we could easily let this go, and we can't afford for that to happen. Otherwise, we will see here what we're seeing overseas, and those images of 20-bed ICUs being filled with 60 patients is absolutely horrifying. And at the moment, our ICUs appear to be coping with their workload, but there's a potential for this still to deteriorate if we do become too complacent.
Yeah, absolutely. And the way you just described that put little chills on the back of my neck, because I listen to a lot of podcasts, and there was one recently with an infectious diseases doctor, and he was basically saying it's a winter, not a blizzard. So don't go to your house expecting that this will blow over in a day or two. This will be a 6-month adventure for the community and not for your household. And
that's right.
That to me was a great way to articulate what is in front of us. So within the week, the frustrations and sort of as a representative of the nurse practitioners in Australia, what can we do? How do you feel about where we are at the moment and what we can do to move forward?
Oh, look, I think the responsibility is on the professionals here. It's on the professional organisations to really talk to each other, collaborate, and have those conversations. I was just watching the Prime Minister's press conference where he was talking about people need to actually sit down and talk, obviously with that social distancing in place. But, he's talking about commercial landlords and tenants sitting down and talking. He's talking about sitting down with your opposition. He's talking about the National Cabinet. They're sitting down and talking. I think professional associations in the medical and nursing and health space need to start talking to each other better. And we need to have a more consistent and collegiate approach rather than having a competitive approach. We must work together. Otherwise, we're never going to see health professionals working to their full capacity. We're never going to see the best healthcare that we can offer to Australians. At the end of the day, unnecessary constraints on healthcare, because that's what they are, they're unnecessary, impact on quality and access to care. And there's no getting around that. And I think we all need to sit down and have a talk about the best way to get through that.
Yeah. Managing things is easy. Managing people is tricky, right?
People are hard.
These humans, but you're dead right. I've worked in a couple of wars. I've worked in Africa. I've worked on the North Pole, and I tell you what, when you're in a frisky situation and you need to get a job done quickly, leadership stands out as clear as light during the night. you know, you need someone to steer the ship, to have the voice, to have the face. And, you know, even as I think about it now, when I think about the media in Australia, we don't really have a nurse, or, you know, maybe we can start building that relationship with the community by having a voice to speak out. And, you know, there is a lot of different professional bodies as well. That's another thing. Probably this is a good time for these professional bodies to remodel and look at their business model and understand how better to enable the nurses or their members to go forward.
Yeah, well, that's right. And simply collaboration between these organisations. And, you know, I've actually found that to be a really positive thing about this pandemic. I mean, we were already working on it as an organisation, making connections with other nursing professional organisations, other specialty nursing organisations, and in fact some medical associations as well. We've been building relationships with them to the point now where, you know, if we've got something to say or we've got something that we want to work on, we discuss it with them and say, okay, who wants to work on this with us? Is there any way that we can get some joint messaging around this, some consistency in approach? Because doing things 100 different ways doesn't work for anybody.
Yeah.
So I'm finding so many are wanting to come to the table. It's really, really, that is a real positive. And, you know, this week alone, we've had meetings with multiple nursing organisations that are really working hard to work through the problems that we're facing at the moment. And, you know, it's not that difficult to come to the same idea or accept the same approach when we're all fighting for the same thing.
Yeah.
And we're not fighting to be the best organisation or the main organisation or anything like that. We're fighting for the patient. We're fighting for the patient to have access to care. So we're actually not trying to further our own needs. We're trying to look after people.
Yes.
And I think that makes it a lot easier.
Yeah. Yep. Absolutely. And, you know, as you talk about that, because essentially what you're talking about is the network across Australia and the bigger, broader, but, you know, I'm just thinking internally about locally, even just emergency speaking to intensive care better than they used to. You know, they've got to transfer patients. And, you know, I've got little warm and fuzzies because I'm really proud of my colleagues because they're at work troubleshooting between departments. And this is something that, you know, traditionally there's always us and them type of situation. But whether it's locally like that or more broadly across the health service or as you're talking across the nation in terms of professional bodies. But so we do have to get the job done. And all of that comes back to the curve, right? Like that's what we're here to do is to manage the healthcare service to make sure that people can have access, and when they do, that access is of quality.
Yeah, that's right. And, you know, this week I've really been focused too. I'm deeply worried about aged care. Yeah. And I'm deeply worried about the fact that residents in aged care already struggle to get healthcare, to get their primary care needs met, to get their, you know, good quality healthcare into those facilities. And many of them don't have access to anything. Many of them are lost on the way. And now we have coronavirus impacting on that even further, that more and more health services or primary care services are pulling out of residential aged care. And when you add that into the fact that we're now about to face flu season, and we need to be immunising these residents. We need to be doing it now, and nobody's going in to even, you know, provide their regular health care in so many cases, in such a high proportion of residents. Yeah. And we're about to face our flu season as well. And I just think, you know, this needs attention, and this to me is absolutely urgent. So that's sort of one of the main focuses I've had this week, and it's one of the things that deeply troubles me. Yeah,
look, you know, I had a friend just come back from New Zealand, so they're on quarantine, but they live with their grandparents, and they live about 2 minutes away, one of my best mates, and, you know, her grandma takes warfarin, so she has her INR checked every fortnight, but, you know, she's not supposed to go out and go up to the street. She can hardly drive, so no one's, you know, to get a home visit is really difficult. They're really booked. And then all of a sudden, I just start thinking really broadly about outside of nursing homes, elderly people who've been sustaining and doing really well, living a good life, exercising, but they need some kind of health monitoring, and all of that has fallen over. That's the other thing that's, is that
the home visit is long gone from our healthcare system, and that needs to change. That really needs to change into the future, regardless of coronavirus. We need to think about taking healthcare to where people need it. There's a lot of value in home visiting. There's a lot of added value to the person, the patient, and the carers and the family. And that needs to go back. And that's why we're also pushing for nurse practitioners to be able to do home visits, because we're actually putting our hand up and saying, hey, yeah, we'll do it. We'll do them. We'll go into residential aged care. We'll go into the home. We'll help people to stay at home longer. We'll support them to have their palliative care wherever they choose to have it. So how about, getting some of those chains off us, loosen the restraints a little bit, and let us get about our business unrestricted.
It's so fascinating, isn't it? Because, you hear stories from the US where they've just, allowed medical students to graduate early. Nursing students are minimizing clinical and just getting in and working. And then these smaller sort of policy changes around allowing expert nurses to just do a little bit more autonomy within their work is so restrictive. It does seem a little crazy.
Yeah. Well, a lot of the restrictions, to be honest with you, in the private sector, so the nurse practitioners that work under MBS, most of them are around finances, which is in its own way a little bit more disturbing. And it does affect the nurse practitioner if they choose to bulk bill. But at the end of the day, this is a patient rebate we're talking about. MBS is a patient rebate. And if a patient chooses to see a nurse practitioner, and many do, they certainly value the service they receive as a lot more than what their rebate is. And, a lot of nurse practitioners' business models aren't sustainable on bulk billing. And I just think it really affects people's access to care. The other issue is too, there are PBS restrictions where our patients don't have the same entitlements to those pharmaceutical benefits that patients of doctors have. Some of our patients miss out on that purely for the fact that a nurse practitioner has written that prescription. So, in this time where people are losing jobs and, we're all struggling a bit financially, and with probably most likely the worst yet to come, that's one of the issues that we have raised this week is, let's loosen the PBS restrictions on nurse practitioners, because at the end of the day, that only benefits the patients. Fortunately too, I have had a very rapid response in relation to that. I can't say that problem's solved, but unlike many of the other issues, it has been responded to promptly. So I'm really, really positive about that. Whether we have a win or not, I don't know. But hey, I've got a really good answer from them very, very quickly. If only I had that from other departments.
Yeah.
So it's a massive collection of issues.
Yeah, getting one department and getting another. So from a primary healthcare perspective, Western Australia has just started doing something fascinating. You heard about this, obviously. They're testing generally anybody who has an ERT type symptom in the community from a COVID perspective. Yeah. So this is...
And I think,
Sorry, you go.
I was just going to say, well, that really captures those people that only get a mild form of the disease. Because it's really important to identify it, because they spread that to other people. It can be quite catastrophic.
Well, I think that's how South Korea essentially defined their effort, was by the ability to test these type of people, which we haven't done on the East Coast here. And, at the moment we can see our curve, it is coming down, but obviously it's exponential. We're still doubling. It's just that it's taking a week to double rather than 4 days, hence the curve being a little further down. But as you said, it's a long game. we start testing our community. You know, my wife went to Woolworths today, and you know it was packed, and everybody needs to eat. I get that, but
Yeah.
apparently the behaviours in the store were, you know, people were just chatting and laughing, and that's great. But everyone was doing it together rather than social distancing, and there was that relaxed attitude to the environment. My wife was concerned when she came home because it felt like people had sort of. It's only been a week. We're going to have to do this for a couple of months.
Yep. I can't begin to tell you, I went to my local supermarket last week to get all of 2 things, which I was desperate for. And I can't begin to tell you how many people I lectured. In particular, in the freezer section, as I was reaching for something, I turned around, there were 4 people crowded behind me, and I started telling them all about, you know, how far 1.5 metres looks, and in fact, I'd prefer 2 metres if you don't mind. So they really copped a lecture, and you know, it's probably not a good idea to be doing that, but I guess every little bit helps. But there are certainly quite a few people that are not taking this seriously. But fortunately, it appears that most of our community are. Yeah, well, anybody I see certainly cops a lecture, but I think people are used to that from me.
Yeah, well, you know, you've got to have a voice. And I think the thing is, you know, we have to, our government, in curtailing the international travellers, I think they've done well. You know, they did respond a little slow initially, but then they got on the ball, and, you know, popping these people into hotels and really restricting them, I think, from an international spread has been really helped us statistically. But this community transfer is essentially, you know, we're wandering into the forest at night here. We really don't know. But the community transfer numbers, we can only hope that people are doing self-distancing and staying at home, and then we can plateau and start to manage this, and, you know, eventually see a down curve. But only time is going to tell us that.
We can only hope, you know. But I'm interested in the data that they were discussing at today's press conference, that we've got the highest testing rate in the world. So we've actually tested a higher proportion of our population than any other country.
Really?
Yeah, that's what they were saying. So we're at about just under, I think it was just under 1% of our population has been tested, and that's actually high according to the international rates.
Well, that's interesting. Like, I even, because I actually got tested yesterday. So my son came home from daycare a week ago, and then just, you know, generally gave us some general dirty daycare disease. But, you know, I ticked the boxes for COVID, and they, you know, a little bit of conjunctivitis, a little bit of, you know, sore throat, blah, blah, blah. And the doctor, he thought about it for a minute. He wasn't just giving me the test straight away. You know, like, I feel like it's not that easy to get a test in Australia.
No, it's not. And I think, you know, the fact of the matter is there are only so many. And, you know, we're looking at can we manage someone with a minor form of the disease and keep them isolated when we suspect they have COVID-19? What people do we absolutely need to reserve the tests for? And I mean, ideally we could test everybody, but unfortunately resources are limited. Hopefully there's work being done to resolve that.
Yeah, definitely. Well, you know, I'm pretty much nearly finished my beer. I don't know how your wine's going, but I'll have to get another one in a minute. As we have our little mental health day on the weekend, if some nurses get that, of course, as we go into next week, how do you feel we should enter the week?
Look, I think we have to enter the week understanding that this is a long process. And some people might call me out on being a hypocrite here, but we have to look after ourselves. We have to take one day at a time. We have to make sure that we have some time out. We have to make sure we sleep well, eat well, all of those sorts of things. And we have to look after our mental health. Any time where people go through something that is highly challenging and emotional and devastating, a lot of the time, we prolong that situation, we're going to have significant effects on people's mental health. So if everybody can just take some time out and take a break and actually, you know what, it's okay to be affected by this. It's okay for your mental health to be suffering. That doesn't mean that there's something wrong with you, but you do need to go and get some sort of help. You need to talk to somebody. Maybe you need to take some time out. I'm having a bit of a catch up with friends tomorrow via video conference. So we're just going to act like we're all in the same room, and we're going to have our usual laughs and a bit of fun. And hopefully that takes us away from the situation at the moment, being that most of my friends are healthcare workers as well. I think that's going to be a really good thing for all of us. And I think we all have different ways of doing this, but I think, you know, we need to make sure that we're prepared for this to go on for months. And I think we have to look after our physical and mental health.
Yeah, definitely. And, you know, I'm floating in this realm. You know, I have my little business that I do, and we launch our online business on the 1st of May. And, you know, there's obviously a lot of work that goes into that. I'm working clinically. I've got a 1-year-old. My wife is 30 weeks pregnant. But the real thing that I found really fascinating about this sort of the last month is that everybody has something, right? Like, this is life. Everybody is worried about something, and the way everybody applies themselves either to their job or, you know, the way they speak to the teller at Woolworths, or, you know, everyone is under so much pressure at the moment. And if we were just in a war and we were fighting someone, and I think the general community and spirit and collegiality would be a lot different. But because this is such an invasive, you know, pandemic and being viral, and it does have a very interesting psychology around how people apply themselves at work, you know, how they manage their home life. And, you know, I'm seeing news reports about people living in another house while the pandemic's here so they don't give it to their kids. And, you know, it's really affecting people. And I think that's really good advice that you've given about that, because it's real, man, and it's here.
Yeah, and it hurts. Like, I'm a single parent, and my son is not seeing his father at the moment because I'm immunosuppressed. And, you know, his father agrees that we don't want anybody bringing it into this house because I've got work to do. I've got things that I need to achieve. So, and my son needs me. So, you know, it hurts my son as well. It's hurting everybody. Every single person's hurt by this, and we do need to be a bit kinder to each other.
Yeah, I think that's a really valuable thing, is to look out the window, you know, take in the vista and just think about who you are and how you interact with those around you just in the current world, because people need each other. I think that's a good, valuable little summary from this chat.
Absolutely. And you know what? Maybe this is our third world war. It is the equivalent. Mass casualties, you know, economic disaster, significant effects on the mental health of the worldwide population. I mean, really, comparative.
It hasn't even started, like, really, you know. I think that's the real kicker for me, is that I've already interviewed an emergency physician from Madrid. I've talked to a new graduate nurse in Bergamo in Italy, a nurse in New York City, and now yourself. And, you know, when you interweave the stories, you realize there's heartache and there's hurt, there's loss, there's grief. But the thing is, the wave is only just starting, really. You know, like you say, we're just hitting the season, and the season is Corona, unfortunately. And we've got to bunker down and get ready for that. And I think doing it together is the right way forward. But listen, tomorrow night, don't drink too much on your Zoom session. You take it easy. You're going to feel on Sunday, and you'll feel better for it on Monday, all right?
All right. Well, thank you for your time, and I'm really glad you're out there talking to people.
Yeah, look, I said at the start of this, I do virtual reality, and we do all this fancy tech stuff, and it's all cool. It is good, and I think, you know, it's gonna make a difference. But in the last month, I've just been speaking to people, and that value and being able to share that conversation with the nurse next to me and then discuss that, it's been really meaningful, and I've been really enjoying it. And I think there's more of a place for it in nursing.
Definitely. Keep it up.
No worries, mate. All right. Well, you take care. Put your feet up. You deserve a rest, and we might talk to you again in the future.
Definitely. Thank you.
All right, Leanne, take it easy.
Okay. Bye.